All India Radio presents Morning News. Good morning. I am V. Ravi Kumar and with me is Subhadra Ramachandran. The headlines. Central team to visit Bihar today to assess COVID-19 situation in the state. Health Ministry issues guidelines for gated residential complexes to set up COVID care facilities. ICMR to conduct study to evaluate effectiveness of BCG vaccine in preventing morbidity and mortality in elderly persons. Jammu and Kashmir Administrative Council decides to provide life insurance cover of 25 lakh rupees to all elected representatives of local bodies. India summons Sharjah Zafar of Pakistan over killing of 3 innocent civilians in ceasefire violation in Jammu and Kashmir. An Iranian president says coronavirus infected 2.5 crore Iranians. A central team will visit Bihar today to assess the COVID-19 situation in the state. The 3-member team, led by Joint Secretary in Health and Family Welfare Ministry Love Agarwal, will review the existing situation and provide necessary support and guidance to the health authorities in the state. Soon after the arrival, the central team will hold discussions with top health officials of the state government and the Chief Secretary. The team will also visit Gaya to assess the increasing number of corona cases. Minister of State for Health and Family Welfare, Ashwini Kumar Choube, said that the centre is keeping a close watch on the situation in Bihar and both central and state governments have initiated all possible steps to contain the corona pandemic. Mr. Choube said the discussion on testing, containment zones and hotspots were held in respect of the state. With 1,667 fresh patients, the total corona cases in the state has gone up to 24,967. Recovery rate in Bihar stands at 63%. The Health Ministry has released guidelines for gated residential complexes that wish to set up small COVID care facilities in their premises. The guidelines said the COVID care facility will be a dedicated health facility for management of suspect, asymptomatic, pre-symptomatic and very mild cases of coronavirus among the residents of the particular gated complex. It said this facility is not meant for elderly patients, less than 10 years child, pregnant and lactating women, patients with comorbidities who shall be admitted to the appropriate COVID care health facility. The guidelines further said the COVID care facility will be a makeshift one which may be set up in the community hall, center, common utility area within the premises of the residential complexes or empty flats. It said the COVID care facility should have a separate entry and exit. Entrance to have mandatory hand hygiene and thermal screening provisions for caregivers. The bed shall be placed with spatial separation of at least 3 feet from one another. The guidelines further said used linen, pillow covers, towels can be kept in disposable bags for 72 hours and then washed at the patient's home using commonly used detergents. It said cleaning and regular disinfection of frequently touched surfaces like doorknobs, elevator buttons, handrails, benches and washrooms to be carried out twice daily in all common areas. The guidelines further said monitoring of the facility will be regularly done and it shall be regularly inspected by the registered respiratory therapist to provide guidance to the RWA and the residential society.
Health Minister Dr. Harshvardhan has said that the human trials of indigenous corona vaccine has started and the fight against COVID-19 is in a decisive phase. In a tweet, Dr. Vardhan said efforts were going on for development of the vaccine for the past several months and there has been positive signs. The Health Minister said India will soon be able to win against the epidemic completely. He said there has been no side effects in the initial trials. The Minister said trials are taking place in 14 institutes. He said ICMR scientists are keeping an eye on every data. Indian Council of Medical Research ICMR will conduct a study to evaluate the effectiveness of the BCG vaccine in preventing morbidity and mortality due to COVID-19 in elderly individuals. The study will be conducted on people aged between 60 to 95 years of age living in COVID-19 hotspots in the country. This study will be carried out in 6 states: Tamil Nadu, Maharashtra, Gujarat, Madhya Pradesh, Rajasthan and Delhi. The ICMR's National Institute of Research in Tuberculosis NIRT in Chennai is heading the study. The study will document whether BCG vaccine can prevent the occurrence of the coronavirus infection and its progression among elderly individuals. The study uses the same BCG vaccine that is administered to newborn babies as a part of national immunization program in the country.
The AIIMS Ethics Committee has given its nod for a human clinical trial of the indigenously developed COVID-19 vaccine candidate Covaxin. AIIMS is likely to begin the exercise by enrolling healthy volunteers from Monday. AIIMS Delhi is among the 12 sites selected by the Indian Council for Medical Research for conducting Phase 1 and 2 human trials of Covaxin. In Phase 1, the vaccine would be tested on 375 volunteers and the maximum of 100 of them would be from AIIMS. Healthy volunteers having no comorbid conditions and without a history of COVID-19, aged more than 18 years and less than 55 years, would be eligible to participate in the randomized, double-blind, placebo-controlled clinical trial. In Tamil Nadu, the total COVID-19 infection has crossed 1,65,000 and 4,807 new cases yesterday. A record 88 people succumbed to the disease in the past 24 hours. More than 3,000 patients returned home after recovery in the same period. State Health Minister C. Vijaya Bhaskar has said that a plasma bank in Chennai will come into operation very soon. A report.
Works on establishing the country's second convalescent blood plasma bank in Chennai to treat COVID-19 patients is progressing at a fast pace. The State Health Minister Dr. Vijay Bhaskar has appealed to those who recovered from the disease to come forward to donate their blood plasma. Talking to reporters at Thoothukudi yesterday, he said the experiments with the therapy in the state has given encouraging results. He reiterated there are enough RT-PCR kits and all other medical inputs are in sufficient stock. Jai Singh, AAR News, Chennai.
In Karnataka, 4,537 new COVID-19 positive cases were reported yesterday. Among the new cases, 2,121 are from Bengaluru, 509 from Dakshina Kannada, 186 from Dharwad and 176 from Vijayapura districts. Here is a report.
A total number of 1,098 patients recovered from various hospitals in the state yesterday, and the total number of patients recovered so far has increased to 21,775. The recovery rate of the state is 36.50%. As many as 93 patients succumbed to the disease, and the total deaths climbed up to 1,240. 580 patients are in ICU in various hospitals in the state. Meanwhile, the Karnataka Medical Education Minister Dr. K. Sudhakar said that government has issued a circular for mandatory admission of asymptomatic and mildly symptomatic cases in COVID care centers or home isolation. Private hospitals should not admit asymptomatic patients, but only critical patients, and hand over 50% of their beds to the government for treating COVID patients. R. Murthy, AAR News, Bengaluru.
With more than 3 lakh cases, Maharashtra is leading the corona tally among states. Pune has become the hotbed for the novel virus with ever-increasing cases. The city recorded 1,589 cases yesterday, which is more than Mumbai, where 1,186 new cases were reported on the same day. More from our correspondent.
With growing cases in Pune, the hospitals in the city are now falling short catered to the rapidly increasing requirement for special beds for corona patients. At present, there are 9,400 patients in 12 COVID centers, while another 18 COVID centers are being set up. COVID care centers have also been started now in various colleges in Pune. Currently, Pune has 29,583 active coronavirus cases, while Mumbai has 23,948 active cases. Meanwhile, the civic administration of the district has issued stern actions to 3 private hospitals to start COVID centers in next 48 hours, failing which action will be initiated against them. Devapriya Bhattacharjee, AAR News, Mumbai.
In Gujarat, as many as 1,061 patients were discharged yesterday across the state, taking the number of the recovered cases to 34,005. The state reported 960 new COVID-19 cases in the last 24 hours. This is the highest single-day surge in the state so far. More from our correspondent.
The State Health Department said that 19 people died of COVID-19 yesterday, taking the death toll to 2,127. Surat reported the highest number of 268 cases yesterday. However, the number of discharges in both the districts is also rising. Surat reported the highest 337 recoveries yesterday, followed by Ahmedabad 169 and Rajkot 139. The state has now 11,344 active cases of COVID-19 and a condition of 75 patients is critical. Meanwhile, the Gujarat Food and Drugs Control Authority has unearthed a racket in the manufacture and sale of fake tocilizumab injections and seized machinery and raw material valued rupees 8 lakhs from a Surat premises. Aparna Khun, AAR News, Ahmedabad.
Chhattisgarh government is considering a lockdown from July 21st, mainly the urban areas in the wake of a surge in COVID-19 cases at several places, including in the state capital Raipur. Last evening, Chief Minister Bhupesh Baghel, Health Minister T.S. Singhdev and other ministers had a meeting where it was decided to authorize the district collectors concerned to take a call after assessing the situation for imposing restrictions. Meanwhile, the Chhattisgarh government has decided to impose a penalty and to take strict action against people for not following the precautionary measures for COVID-19. In Uttar Pradesh, 55-hour-long weekly restrictions imposed on Friday night continued across the state. The restrictions will come to an end at 5 a.m. tomorrow. As per the restrictions, all offices, business institutions and markets in urban and rural areas across the state will remain closed every Saturday and Sunday. However, emergency and industrial activities have been allowed. Our correspondent reports cleanliness and sanitization works in markets and institutions are taken up during the restrictions.
While reviewing a high-level meeting on COVID-19 at Lucknow yesterday, Chief Minister Yogi Adityanath instructed to carry out the process of contact tracing of COVID-19 patients to control the spread of infection. He appealed people not to come out of their homes unnecessarily and use face cover or mask compulsorily. Meanwhile, with getting 1,986 new cases, the total number of corona cases in the state has reached to 47,036. Additional Chief Secretary Health Amit Mohan Prasad said that there are 17,264 active cases in the state. He said, as of now, 28,664 patients have got cured and 1,108 succumbed to COVID-19. MS Yadav, Area News, Lucknow.
Uttarakhand Chief Minister Trivendra Singh Rawat has directed all 13 district magistrates to monitor all serious cases of COVID-19 and focus on maintaining oxygen support in hospitals. He gave the directions during a video conference meeting with the DMs to review the pandemic situation in the state. Chief Minister also informed about the cancellation of holy bath on Somati Amavasya in Haridwar tomorrow. He urged the devotees to take bath in their homes, remembering Ma Ganga due to the pandemic situation. In Madhya Pradesh, during the corona pandemic, silk has become the source of livelihood for hundreds of tribal families and is making them financially empowered and self-reliant. More from our correspondent.
The silk department procures silk yarn worth rupees 5 crore from farmers every year in Madhya Pradesh. Many farmer families of Hoshangabad district collected around 25,000 kg of cocoon and earned up to 60 lakh rupees during the lockdown. Hoshangabad district silk officer Sharat Srivastava informed that silk is a profitable cultivation and about 700 farmer families from 20 villages of the district have adopted it as a livelihood.
जिले के लगभग 250 से 300 किसानों ने रेशम कृमि पालन का कार्य किया है और इस अवधि में उनके द्वारा लगभग 25,000 किलोग्राम ककून उत्पादन विक्रय किया गया है, जिससे उन्हें लगभग 50-60 लाख रुपए का ककून भुगतान किया गया है। उम्मीद करते हैं कि जिले के अधिक से अधिक किसान रेशम कृमि पालन योजना को अपनाएंगे।
65% of the silk in the country is imported from abroad. The farmers are confident that under the Self-Reliant India scheme, we can produce 100% of silk in the country. With Tanush Tiwari from Hoshangabad, Sanjeev Sharma, AIR News, Bhopal.
Iranian President Hassan Rouhani has said that coronavirus has infected 2.5 crore Iranians. During a televised meeting of the country's virus-fighting task force, he said the pandemic can infect 3.5 crore Iranians as the country is yet to develop herd immunity. Rouhani also said that Iran may have to prepare itself for double the amount of hospitalizations it has had in the past 5 months. Later, Rouhani's deputy head of communications, Ali Reza Moezi, explained that the 2.5 crore infections refers to those who have encountered the virus and achieved complete immunity. It appears to be the first time a senior Iranian official has indicated that the country is seeking to defeat COVID-19 via herd immunity. In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Dr. Ambuj Roy from the Department of Cardiology of AIIMS advises elderly people and those suffering from other diseases like hypertension and cancer to take extra precautions to avoid the infection.
In the larger population, it has given them time to understand the seriousness of the disease, the precautions they need to take, how to live with this. They have practiced social distancing. The people who already have heart disease, people who have had brain strokes, people who have lung disease, people who have some kind of cancer, they're much more prone to a more severe form of the disease if they get the disease.
Dr. Naresh Gupta of LNJP Hospital, Delhi tells people to maintain hygiene and social distancing.
खांसने के समय ऐसा खांसना छींकना चाहिए कि दूसरे के ऊपर नहीं जाए। टिश्यू पेपर रखे, रुमाल रखे, कोहनी रखे, बचाव करे। एक इसमें और चीज आती है, वो आती है डिस्टेंसिंग का। जब वो खांसता छींकता है तो 1 से 2 मीटर तक वो जा सकती है। अगर आप पहले 1-2 मीटर का फासला बना के रखेंगे तो उसका आपके तक पहुंचने का अंदेशा बहुत कम हो जाता है। जो कॉन्टेक्ट ट्रांसमिशन की बात आई फॉर्माइड से, उसके लिए हम कहते हैं कि आप हाथ साफ करें। हाथ अगर आप धोते रहेंगे तो उसमें जो वायरस है वो साबुन पानी के द्वारा निकलता रहेगा। और उसके साथ साथ अगर जरूरत समझे या पानी नहीं हो तो आप सैनिटाइजर का इस्तेमाल भी कर सकते हैं।
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Central team to visit Bihar today to assess COVID-19 situation in the state. Health Ministry issues guidelines for gated residential complexes to set up COVID care facilities. ICMR to conduct study to evaluate the effectiveness of BCG vaccine in preventing morbidity and mortality in elderly persons. Jammu and Kashmir Administrative Council decides to provide life insurance cover of 25 lakh rupees to all elected representatives of local bodies. India summons charge d'affaires of Pakistan over killing of 3 innocent civilians in ceasefire violation in Jammu and Kashmir. And Iranian president says coronavirus infected 2.5 crore Iranians. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Jammu and Kashmir Administrative Council has decided to provide life insurance cover of 25 lakh rupees to all elected representatives of local bodies in the Union Territory. This will be applicable to all elected members of Panchayati Raj institutions and urban local bodies of the Union Territory in case of death due to a terror-related incident. The decision is aimed at strengthening the grassroots democracy by providing a sense of security to the elected members of local bodies who are under constant threat from terrorists. The Administrative Council AC, which met under the chairmanship of Lieutenant Governor G.C. Murmu, approved life insurance cover to all elected Block Development Council BDC chairmen, sarpanches, punches and all elected members of municipal bodies. An official spokesman said the life insurance cover will ensure that the families do not face economic distress and poverty in case of any untoward incident.
Days after a ban was imposed on 59 Chinese mobile apps, Union Minister Ravi Shankar Prasad has said that the central government will not tolerate any compromise with data sovereignty of India. Addressing Thakur Prasad Memorial Lecture via video conference, he said, data of Indians belong to the people of India. Mr. Prasad also emphasized that banning the Chinese mobile applications has created an opportunity for Indian developers. Stressing upon the need to secure the data of the people, he said, Centre has brought a data protection law which is being examined by the Select Committee of Parliament. Mr. Prasad further emphasized that Digital India today has become a transformative program whereby common Indians are getting empowered through technology. He said the great JAM Trinity, Jan Dhan, Aadhaar and mobile has led to a transformation in governance.
India summoned the charge d'affaires of the Pakistan High Commission and lodged a strong protest on the death of 3 innocent civilians, including a child, in an unprovoked ceasefire violation by Pakistani forces. The incident had occurred on Friday night in Krishna Ghati sector in Jammu and Kashmir. The deceased persons belonged to a single family. India has condemned in the strongest terms the deliberate targeting of innocent civilians by Pakistani forces. India also protested Pakistan's continued support to cross-border terrorist infiltration into India, including supporting cover fire provided by Pakistani forces. India has conveyed appreciation to the Afghanistan government and tribal elders whose efforts secured the return of Nidan Singh. Mr. Nidan Singh Saddewa, a leader of the Hindu and Sikh community of Afghanistan, was kidnapped from Chamkani district of Paktia province on 22nd June. He was released from captivity yesterday. External Affairs Ministry said the targeting and persecution of minority community members by terrorists at the behest of their external supporters remains a matter of grave concern. In a recent decision, India has decided to facilitate the return of Afghan, Hindu and Sikh community members facing security threats in Afghanistan to India.
Finance Minister Nirmala Sitharaman participated in the 3rd G20 Finance Ministers and Central Bank Governors meeting through video conference yesterday. The meeting discussed the global economic outlook amid evolving COVID-19 pandemic crisis along with other G20 finance track priorities for 2020. The finance minister in the first session of the meeting talked about the G20 action plan in response to COVID-19, which was endorsed by the G20 finance ministers and central bank governors in their previous meeting on 15th April 2020. This G20 action plan lays out a list of collective commitments under the pillars of health response, economic response, strong and sustainable recovery, and international financial coordination aimed at coordinating G20 efforts to fight the pandemic. Ms. Sitharaman emphasized that it is crucial to ensure that this action plan remains relevant and effective. The minister shared with her counterparts how India is working on ensuring this balance through credit schemes for greater liquidity, direct benefit transfers, and employment guarantee scheme. Income Tax Department is all set to start an e-campaign on voluntary compliance of income tax for the convenience of the taxpayers from tomorrow. The Central Board of Direct Taxes, CBDT, has said that the 11-day campaign will focus on the assessees or taxpayers who are either non-filers or have discrepancies in their returns for the financial year 2018-2019. It said the objective of the e-campaign is to facilitate taxpayers to online validate their tax and financial transaction information available with the IT department and promote voluntary compliance, especially for the assessees for 2018-19, so that they do not need to get into notice and scrutiny process. CBDT said that this e-campaign is being run for the benefit of the taxpayers. Under this campaign, the Income Tax Department will send email and SMS to identified taxpayers to verify their financial transactions, related information received by the IT department from various sources such as statement of financial transactions, tax deduction at source, tax collection at source, and foreign remittances. CBDT stated that data analysis has identified certain taxpayers with high-value transactions who have not filed returns for the assessment year 2019-20. In addition to the non-filers, another set of return filers have also been identified wherein the high-value transactions does not appear to be in line with their income tax return. CBDT said that under the e-campaign, the taxpayers will be able to access details of their high-value transactions, related information on the designated portal. There will be no need to visit any income tax office as the response has to be submitted online. CBDT further said that the last date for filing as well as revising the income tax return for the assessment year 2019-20 is 31st July 2020.
Sri Ram Janmabhoomi Tirth Kshetra Trust has finalized the schedule for construction of Ram Temple in Ayodhya, and Bhumi Pujan of the construction area will be done either on the 3rd or 5th of August. The decision was taken in a meeting of the trust members in Ayodhya yesterday. More from our correspondent.
Trust decided that the date of Bhumi Pujan will be finalized after confirmation of Prime Minister's office regarding PM's visit. Member of the trust, Kameshwar Chaupal, said that PM has agreed to come to Ayodhya and now the construction work will start on the date which will be decided by PMO, that is either on 3rd or 5th August. It said that there is a slight change in the design of Grand Ram Temple and now there will be 5 domes instead of 2. The height of the temple will also increase to 161 feet. Talking to media after meeting, Secretary of the Trust, Champat Rai, said that it will take almost 3 to 3.5 hours to complete the construction of the Ram Temple. Sushil Chandra Tiwari, AIR News, Lucknow.
In Manipur, State Forest, Environment and Climate Change Minister Awangbao Nyumai has said that the centre has agreed to open additional 100 Pradhan Mantri Van Dhan Vikas Kendras in the state. The Tribal Cooperative Marketing Federation of India, TriFed, is ready to provide funds for the storage of the forest products and construction of hut bazaars in the border areas. While inspecting the Kazipung Van Dhan Vikas Kendra VDVK in Hill District, the Minister of the State said that the Pradhan Mantri Van Dhan Vikas Yojana, which aims to transform the economy of tribal people, was launched in the state last year. Under the scheme, the state government will focus on collection, processing and value addition of non-timber forest products. Manipur has 77 Van Dhan Vikas Kendras comprising 1,995 self-help groups or SHGs and 23,259 beneficiaries. Registration of another 100 VDVKs is under process and the state government is planning to open 16 new VDVKs in Ukhrul district and another 14 new VDVKs in the Kamjong district. Mr. Nyumai said Manipur is number leading in the country, but we need a policy to sustain so that SHG's members remain energetic and encouraged. TriFed has agreed to do funding for making storage and construction of hut bazaars. He said from this year, the department has enabled the SHG members to collect wild fruits and medicinal plants which can be made as products.
The lift-off of the United Arab Emirates Mars orbiter, which was postponed due to bad weather at the launch site in southern Japan, is now set for tomorrow. The orbiter, named Amal or Hope, is the Arab world's first interplanetary mission. The launch, initially scheduled for Wednesday from the Tanegashima Space Center, has been reset for 6:58 a.m. Monday. The UAE leaders have reviewed the Hope probe's pre-flight preparations days before its historic launch to Mars from Japan's Tanegashima Space Center. The Mars data gathered by the probe will be a scientific discovery dedicated for the benefit of humanity.
Now let us take a look at the weather updates for today. Heavy rain lashed National Capital Region, including Delhi, this morning, bringing much-needed respite from the scorching heat. India Meteorological Department said places that experienced rain include Gurugram, Noida, Ghaziabad and Faridabad, besides Delhi. Met Department has predicted more rain in the national capital and adjoining areas till Tuesday. The minimum temperature was recorded at 29 degrees Celsius, while the maximum temperature is expected to be around 35 degrees Celsius.
Mumbai will have a generally cloudy sky with moderate rain. The city witnessed a minimum temperature of 26 degrees Celsius, will have a maximum of around 30 degrees Celsius. In Chennai, the temperature will hover between 27 and 35 degrees Celsius. The city will have a generally cloudy sky with light rain. Kolkata will have partly cloudy sky with 1 or 2 spells of rain or thunder showers with a minimum temperature of 28 degrees Celsius. The maximum temperature will be nearly 35 degrees. In Jammu and Kashmir, the minimum temperature was 27 degrees Celsius in Jammu, while maximum will be around 35 degrees Celsius. The city is likely to have partly cloudy sky with possibility of rain or thunderstorm or dust storm. In Srinagar, the temperature will hover between 19 and 32 degrees Celsius. The city is also expected to witness partly cloudy sky with possibility of rain or thunderstorm or dust storm. In Gilgit, the minimum temperature was recorded at 20 degrees Celsius, while the maximum will be around 32 degrees Celsius. It is expected to have partly cloudy sky with possibility of rain or thunderstorm or dust storm.
Muzaffarabad may also see a partly cloudy sky with possibility of rain or thunderstorm or dust storm. The place witnessed a minimum temperature of 22 degrees Celsius, while the maximum temperature will be around 34 degrees Celsius. Chandigarh will see a generally cloudy sky with 1 or 2 spells of rain or thunder showers. The minimum temperature was recorded at 27 degrees Celsius and the maximum temperature will be around 34 degrees.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Listeners can ask questions to the experts on toll-free telephone number 1-800-115767. You can also ask questions on telephone number 11011-2331-4444. And this can be heard tonight on FM Go channel and additional frequencies from 9:30 p.m. onwards. And now an overview of today's newspapers. Ram Temple Trust fixes August 3rd or 5th for start of work, requests PM to join in, writes the Indian Express. The paper adds that August 5 will also mark 1 year of the abrogation of Article 370 and the bifurcation of the state of J&K. Capital has turned a corner, says Delhi CM Kejriwal in an interview to Hindustan Times. According to the CM, home isolation was key to turning the tide and complacency should be avoided. In a related story, the Times of India reports that active cases only 14%, 3 or 4 beds free in Delhi city. The Pioneer headline reads, BJP seeks CBI probe into phone tapping. Congress has claimed that the opposition has been caught red-handed in a bid to buy MLAs, adds the paper. Amid all the pandemic news, Hindustan Times features a picture of a forest official trying to give food to a rhinoceros which is stranded due to the Assam floods. A government notice to Twitter for info on India users, says the Financial Express. The Indian Cybersecurity Nodal Agency has sought full details of the recent global hack targeting high-profile users, the paper adds.
And now before we end the bulletin, the headlines once again. Central team to visit Bihar today to assess COVID-19 situation in the state. Health Ministry issues guidelines for gated residential complexes to set up COVID care facilities. ICMR to conduct study to evaluate effectiveness of BCG vaccine in preventing morbidity and mortality in elderly persons. Jammu and Kashmir Administrative Council decides to provide life insurance cover of 25 lakh rupees to all elected representatives of local bodies. India summons Sharjah, the affair of Pakistan over killing of 3 innocent civilians in ceasefire violation in Jammu and Kashmir. An Iranian president says coronavirus infected 2.5 crore Iranians. And with that, we end the morning news. Have a nice day.